The health effects of saturated fat, a comprehensive overview. Saturated fat has long been a subject of debate among health professionals and researchers. Found in foods such as butter, cheese, red meat, and some tropical oils, saturated fat has previously been linked to adverse health outcomes. However, recent research has shed new light on our understanding of its role in human health. For decades, dietary guidelines have recommended limiting saturated fat intake due to its association with increased levels of low-density lipoprotein, LDL cholesterol, often referred to as bad cholesterol. Elevated LDL cholesterol is a known risk factor for cardiovascular disease, CVD, including heart attack and stroke. As a result, many public health organizations have advocated replacing saturated fats with unsaturated fats, such as those found in nuts, seeds, and fish. However, emerging research suggests that the relationship between saturated fat and heart disease may not be as straightforward as once thought. Some studies have found that saturated fat consumption does not always correlate directly with higher rates of CVD. For example, the overall dietary context, such as the presence of other nutrients and food quality, appears to play an important role in determining health outcomes. Whole food sources of saturated fat, such as whole milk or dark chocolate, may have different effects than processed foods high in saturated fat. Individual differences also need to be considered. Genetic factors, lifestyle choices, and existing health conditions can affect how the body processes saturated fat. For some individuals, reducing saturated fat intake can significantly reduce cholesterol levels, while others see only minimal effects. Despite these nuances, most experts agree that moderation is important. The American Heart Association continues to recommend that saturated fat make up no more than 5 to 6% of daily calories for people looking to reduce their risk of heart disease. This is consistent with broader dietary patterns such as the Mediterranean or DASH diets, which emphasize fruits, vegetables, whole grains, lean proteins, and healthy fats. Saturated fat is not harmful in small amounts, but excessive consumption, especially from processed foods, should be avoided. A balanced diet tailored to your individual needs remains the foundation of good health. As research continues to evolve, it is important to stay informed and consult a healthcare professional for appropriate dietary advice.